Thank you for tuning in to our Swansea Bay Full Stop podcast series, part of the big conversation and talking all things falls prevention. Falling or fear of falling affects millions of lives every day, but it does not need to be an inevitable part of ageing, and falls prevention is everybody's responsibility. So let's start the conversation and see what each of us can do to reduce these risks.
Hi everybody, I am really excited to introduce our guest today, David Hughes, MBE. David is a podiatrist by trade and has been qualified for nearly 30 years and is currently the clinical lead and assistant head of podiatry and orthotics.
I've got nearly 30 years post-qualification experience in podiatry. I did take a brief exit from my podiatry career to train as a lawyer. I came back into clinical practice. I always knew I'd be coming back into clinical practice. And luckily, I've got the perfect situation now where I clinically lead in my profession, podiatry, a fantastic team, but I also get to hopefully support healthcare professionals across Wales to be able to understand a little bit more about healthcare law and safe and effective practice. So yes, that's me. I have got a particular, as a podiatrist, I've got a particular interest with falls prevention. I really am heavily focused on the prevention of crisis. And I've been lucky enough to be tasked with several opportunities in my career to be able to look at prevention strategies. So that's a little bit more about me.
We really want to know, as much advice as we possibly can in terms of how we can prevent falls from happening and how that links to foot care. So to kick us off, I guess, why is good foot care so important when it comes to falls prevention and what type of issues might lead to falls?
It's a really good question, and there's a really long answer to that. And the most comprehensive answer would be to actually go into a podiatry degree. So I'm going to start from basics, and it really is the most important message to get out there. And that is, let's start considering the feet as the base and stable platform. The feet are extremely relevant to our falls risk. If we think of the feet having the same number of bones, 26 bones in each foot, the same number as letters in the alphabet, these small little bones, these small structures, each of these form with muscles, tendons and ligaments on a very small platform to provide a firm and stable foundation, not simply like the strong foundations of a heavy building, but also adapting to the extra stresses caused by moving around. So that's a phenomenal amount of work that we expect our feet to do in order to provide us with that firm foundation. As with any building, if the foundations are rocky, the structure will eventually fall down. So it's really looking at the feet from that very basic perspective as a foundation. Any problem affecting the bone or soft tissue structure of the feet will weaken them as a stable foundation to walking. We need to consider the impact foot problems may have on any muscle or joint weaknesses that may increase our risk of falls. A weak ankle, for example, may lead to falls, which in turn causes a vicious circle and damage and weaken the foot and ankle even further with each fall. We need our feet on average to support our body, and some of us, including me, have larger bodies that we need to, and our feet are used to support that movement around huge distances in a lifetime. On average, around 7 times around the world. That's how much our feet enable us to travel in our lifetime.
That's a lot.
It's exactly so it's no surprise that as we get older we may develop some arthritis in our joints, for example, some wear and tear in our joints, some trauma to our soft tissues that keep us stable, and this may be a particular falls risk. The thing with changing joint changes and muscle changes as well, this can actually change the foot shape And we can sometimes develop deformities, which in themselves can cause a problem and impair how we walk and our foundation to walking, our safe foundation to walking. But falls risk isn't restricted to instability, weakness and deformity. We need to consider all of these might also cause pain. And when we have pain, what do? We try to walk off the pain. And that means we might walk differently to alleviate the pain. This is called an antalgic gait, and by its very nature is an unnatural and weaker foundation to walk in, and hence a falls risk. Changes in foot shape and function will usually mean that the huge forces applied to our feet and skin might actually be too much. And that might cause thickening of the skin, thickening of the nails, calluses, corns, and even wounds or, sadly, ulcers to develop. These are often extremely painful, and they also will alter how we walk. I think we need to think of the feet as well as providing this fantastic protective function. We don't have eyes in our feet, but we've got lots of nerve endings enabling us to feel or sense obstacles on the ground. We were designed to walk on the ground with bare feet and be able to pick up if there's a problem, if there's an obstacle in the way. And we rely on our nerves to work really well, particularly when we're wearing footwear that actually blocks some of the sensation for any changes to the terrain. But if there is a problem with our nerves and our sensation, this will often mean we will not pick up on these hazards and we may fall because of that. I think if we think of our feet as well about being served by this really, really complex network of blood vessels, which provide enough blood and oxygen to the complex structures so that they can do their work. Arteries carry the oxygen and the blood down to the feet, and then veins will carry the used blood back to the heart and lungs so that the cycle can begin. Walking around town, particularly of an older generation, and watch them taking a few steps before stopping and perhaps looking in the nearest window, before then starting off again, taking a few steps to the next window and then the next. This may simply be window shopping, but might also be hiding the crippling calf pain associated with walking when there is insufficient blood supply to the legs and the feet. This is called intermittent claudication. There may be a problem removing blood and waste products from the feet, and that often leads to ankle swelling and heaviness in the limbs. That will change how somebody walks. Poor circulation can also make the skin less able to cope with pressure, and if mixed with the additional whammy of poor sensation and deformity, this might lead to significant crises such as ulcerations to develop. So there's a lot going on in the feet.
Absolutely.
And I think that's where, as healthcare professionals working together, we all need to start. And I think that's where us as patients, as members of the public, we need to start appreciating a bit more about our feet and having that wider understanding of our feet. Perhaps we may look after them a bit more and certainly ask for help should there be a problem.
Well, I mean, absolutely. I mean, I love the analogy of that, the being the base of us as beings. And I can literally picture my grandmother now walking in through town and stopping at the windows. And she
Absolutely.
had multiple sclerosis, had a lot of deformity on her feet, but she is a really lovely example of things to look out for.
And invariably, it'll be a shop that sells things that they would be far too embarrassed to either buy or wear.
Yeah, absolutely.
You know the shops I'm talking about.
I know, I do. So that in itself is an indicator, isn't it? But there's some other sort of things that people really should be looking out for that they really should not ignore.
Yeah, and it's the word there is change. we should never ignore any changes to our feet. We know our feet and what's normal for us. We need to seek advice when there are any skin, nail, muscle, joint changes, any pain developing. We need to consider early signs of changes to our sensation. Now, this may not be numbness initially. It might actually be pins and needles, or even perhaps a heightened sensitivity to touch. That's sometimes the paradox. We actually feel more before we lose the sensation.
Right.
We need to get advice if our foot temperature changes from normal. Some feet have always been cold or hot and sweaty. If they suddenly become so, and this is not usual for you, seek advice. Tripping over or going over on your foot and ankle, particularly more than once, may be a sign of weakness or instability, and a history needs to be considered. Are there any new lumps or bumps? Is there any new deformity? If there is, there will be a reason that needs to be considered. We need to look at the cause. Are the shoes that have been so comfortable for such a long period of time now starting to rub in areas that they didn't previously? This is a sign that the feet are swollen or changing shape. Are there any lesions or areas of hard skin, calluses, corns? These can sometimes be managed following advice on self-care, but the cause of those developing needs to be considered to prevent small issues becoming big ones. Have the nails changed at all? Are they changing shape or thickness? Has the skin become drier than normal? Have you noticed any hair loss where hair has always been there? Each of these may be early signs that advice might be needed to prevent small problems becoming big issues.
And some of these, you could easily explain them away, couldn't you? And it's like you say, knowing we are our own experts in our own health, in that we know our feet and we know our bodies, and it's up to us to sort of flag up when those changes are occurring and clear that this is not normal for me.
Yeah, absolutely.
Fantastic. So if people are in that situation and they've found that they've got some changes or they're experiencing some problems, what do they need to do? What's the first steps they need to take?
Well, the first step, if the changes are quite simple and relate to their ability to self-manage and do what they've normally done for themselves, then it's obviously do not allow it to continue, because things will just escalate and get worse. Always seek help. Basic foot care has always been part of our daily routine. It's normally done by ourselves, for ourselves. It's not a highly specialist skill. It's like brushing teeth. It's like washing. It's like dressing. But when basic foot care like skin softening, nail cutting, filing, washing, dressing, putting the correct shoes on, hosiery on, when that's no longer possible, and as we get older, it does become more difficult, we need to ask the right people for help. So we need to speak to those that help us in other ways to see if they can help us do what we used to be able to do for ourselves. So it is about speaking with friends or family or anyone that helps us with other aspects of our care to perhaps give us a hand with our foot care. Interestingly, often patients will present with personal care needs for their feet, which we identify, but that highlights other needs that patient may have in other aspects of their life and health that currently aren't being met. So it's about recognizing when help is needed and having the confidence to access the right people from the right person at the right time.
Like you say, is having those conversations, isn't it? Regardless of who it's with initially, just being open and honest about that and starting those conversations early.
Completely.
A lot of this stuff people will relate to. They know their feet, they're experiencing changes. Like you say, a lot of this stuff is day-to-day self-management that most people manage fairly easily. But I guess what would warrant that specialist service? So what would your role as a podiatry service offer to those people that perhaps have got some more complex issues?
Well, we are there. Podiatry are there when we develop a need for a foot specialist. Podiatrists are the experts in feet and gait-related problems that need advice and interventions that only a foot specialist can provide. I'm really proud to lead Swansea Bay team with my colleagues. We are able to offer a direct open access service to our patients who live within the Swansea, Neath and Talbot boundary. So when there is a need for a foot specialist, patients can self-present. They do not need to be referred by a healthcare professional. By accessing us, it's accessing our role, which is to prevent and treat foot and gait-related problems that compromise the person's well-being and health. We're there to provide a comprehensive specialist assessment and work with our patients to agree an individualised management plan that fits with what matters to them. So it's working with them, it's co-producing and co-creating the best health that they can have. This may mean supporting the patient and their carers to build a confidence to self-care at home. It may mean advising other healthcare professionals that work with them what may benefit the patient to improve their foot health and prevent problems in the future. It may mean we need to undertake specialist treatments to the skin, nail or soft tissues. If that is the case, we can offer that specialist support and intervention. I think it's really important to consider the orthotics service as part of the discussion that we're having today, because podiatry and orthotics work very, very close together. We are really fortunate that we have our in-house orthotists, and orthotists are the experts in correcting problems or deformities in nerves, muscles and bones with a range of aids. They are fantastic engineers and design and fabricate medical supportive devices and measure and fit patients for them. They might include artificial limbs, arms, hands, legs, feet, braces and other medical or surgical devices. The input may be, for example, a foot and ankle orthosis to manage foot drop and the impact that may be having on the patient's walking and stable base of gait. They are experts in the assessment of biomechanics and signposting to appropriate commercial footwear, for example, or the provision of specialist orthopedic footwear where that's indicated, provision of knee braces to support physiotherapy goals, amongst many, many other things. Some devices required may be off the shelf and provided by the orthotist. Some may need to be custom made. So it's a very specialist duo of services, podiatry and orthotics, and hopefully by improving role congruence and getting a better understanding of what we do, and hopefully we'll get some good access to us when it's needed.
I mean, it's a really comprehensive service, and what I love is, if sometimes we panic as carers or as family members, if somebody is at risk of falls and they've got problems with their feet, that people shouldn't be walking around and people should stop mobilizing. But actually the service is about trying to keep those people doing their everyday tasks and keep them as independent as possible by using some specific sort of interventions and lovely gadgets I'm sure you've got within the service as well to
Lots of gadgets.
Well, that is a really great message, I think, for the public, particularly in terms of what they can expect, the help that's out there. There'll be some staff hopefully listening today. So for those staff on sort of general wards or out in the community, what can they do to support patients or to help access or understanding when people should be accessing more specialist services?
I think always considering the foot as the foundation to safe, efficient, effective mobility primarily.
Yeah.
Raise awareness across there, not just to healthcare professionals, but also the public, that anything that impacts on the foot health is likely to cause and increase the risk of falls, and to acknowledge or reflect on there may be known causes in play of a patient's history of falls. It may be medication related, for example, and nothing foot or gait related. However, particularly in the frail elderly population, if this is the case, do not ignore the likelihood that there is a foot or ankle or gait related issue also in play. May not have caused that last fall, but let's do a good assessment when there's an opportunity, just to make sure that any needs for footwear, walking assessments are not ignored, and any hazards that need specialist assessment, treatment or advice are followed up.
Yeah, that's great, because I think often we can be guilty of finding the magic cause, so thinking, oh right, that was caused by X, but actually, yes, like you say, there may well be some either hidden or not so directly related issues that may not have directly affected that fall, but could well impact in the future, and something that, you know, whilst we've got people in our care generally is in the health board, that we're able to just be mindful of that and make sure we're given that comprehensive review of every aspect of the person.
Absolutely. It's about providing that one-stop shop experience when there has been an unfortunate trauma, there's been a fall.
Yeah,
you know, we've got our patient with us as a captive audience.
Absolutely.
Let's really cross all the T's and dot the I's, and at this level that we've discussed today, you know, it's not that onerous. It's just about giving consideration, and even the most cursory glance at the foot can pick up some of these alarm bells that we've talked about today.
Absolutely. And I know I'm certainly going to be checking out all of my family's feet, especially with the summer with people in flip-flops and things. I'll be
brilliant.
But a quick
Summer's a good time to do it.
Absolutely. But thank you so much, David. It's been really useful and enlightening to speak to you. I think from my perspective, as with everybody I speak to, it's really getting that message home that we need to talk about these things. It's okay if there are changes, there are things that can be done. It's part of normal aging and normal progression in life, that will be changes to our bodies and minds. So it's important to have those conversations early so that we can stop the smaller problems becoming the bigger problems, as you say.
Absolutely, Ian. I know that you'll use this as a platform to be able to provide the detail in relation to staff getting in touch with us and patients as well.
Absolutely. We'll put all the contact details and some useful links on the homepage of this episode, so that people can access that in their own time and be able to explore different options that are out there as well.
That's great.
Fantastic. Thank you so much, David. It's been a pleasure as always.
Thank you, Larry, for the opportunity.
So that's the end of this episode. We hope it's provided some useful insights, and please follow the links provided for more information. But remember, falls are not inevitable. Together we can make a difference. Let's keep this conversation going.